Today we're going to be discussing an extremely divisive topic, which is the election and the future of health insurance. So we're going to be speculating based on the information that we have at hand, promises that were made, and what history has shown us. Now, despite your strong feelings, we do ask that you keep any comments civil and constructive. Thank you. So regardless of what the outcome of this election was, promises were made regarding the future of healthcare and health insurance in this country. So now that the election has been decided, we can speculate as to what the future will be. Now, some of these changes may be good and some of them may be bad depending upon your specific situation. But I would like to remind you that with Washington, change takes time, so nothing is going to happen overnight. What we'd like to do now is discuss the changes that may come so that way you have time to prepare. Under the Inflation Reduction Act, premium tax credits available through the marketplace were expanded, largely eliminating that premium subsidy cliff. However, those expanded premium tax credits are set to expire at the end of 2025, so please do not panic. It's not going to affect your enrollment this year. It has been indicated that based on the election results, it is likely that these premium tax credits, the expansion, will in fact be allowed to expire. So as a reminder, under the Inflation Reduction Act, caps on premium contributions for people of all income levels were lowered, so that affected everyone. People who made between 100 to 150% of the FPL, which is federal poverty level, were able to access silver level benchmark plans with $0 monthly premiums due to those expanded premium tax credits. And of course, premium tax credits were expanded even to those who made above 400 of the FPL federal poverty level. And that's what really helped to eliminate that premium subsidy cliff. Now, if you take a look here, the Inflation Reduction Act was in 2022, and this chart shows the total number of people enrolled in a marketplace plan, as well as people enrolled receiving a premium tax credit, as well as those without those advanced premium tax credits. And you can see the growth from 2022 to 2024. And there's significant growth, of course, in 2024, not just in the total number of people enrolled in a marketplace plan, which has been really significant, but also look at the amount of people receiving those advanced premium tax credits. That is significant growth as well. So you can see that it's really going to affect a large portion of the population if those premium tax credits are allowed to expire. Now, if these expanded premium tax credits are allowed to expire, and again, highly likely that they will be, then it is likely that your premium will rise. And some people will feel this more than others. Now, when you're looking at it in terms of hard numbers, then of course, people that have a higher income, people that are over that 400% of the FPL will see a larger increase in their premium tax credits because they may no longer be eligible for premium tax credits at all. So you can see that right here. For people with incomes above 400% of the federal poverty level, lose their subsidies entirely if the enhancements expire. This example they provide, for example, a 60-year-old West Virginia couple, because in states like West Virginia and Wyoming, then the premiums are higher anyway, as well as for people that are older. So a 60-year-old West Virginia couple making $80,000 would see annual premiums for a benchmark silver plan increase more than 6 times, from $6,800 for the year to $43,000. Now that is an extreme example, so again, please don't panic. Now, that being said, even though, of course, those higher earners will see, as far as the numbers are concerned, more extensive increases, that's not to say that people on the lower end of the income scale won't feel it. Because, as you can see here, a single individual making $21,000, 144% of the federal poverty level, would no longer be eligible for a zero premium plan, because many of these individuals were eligible for plans with such extensive premium tax credits that they actually had no more monthly premium. So they would see their marketplace premium rise from $0 to $66, which of course is nowhere near as extensive as the other example we just discussed from, $6,300 to $43,000 or $6,800 to $43,000. But to someone only making $21,000, that's something that they could absolutely feel in a significant fashion. Now, if you're someone who's self-employed, I'd highly recommend that you look to the future and start working with an accountant now to determine how you can better lower your MAGI, which is Modified Adjusted Gross Income, because this is what the marketplace is looking at when determining eligibility for those premium tax credits. You may even want to consider looking to a plan that offers an HSA, which is a health savings account, which can also help lower your MAGI. For this, we'd highly recommend you work with a broker. And if you do need assistance, you can reach us here at iHealthBrokers at the number on the screen or in the comments below with any questions that you may have. We are licensed health insurance brokers and we're licensed nationwide. And of course, we do release these videos on a weekly basis, so please make sure to like and subscribe to stay up to date. It's certain that there will be changes in the coming months and we want to make sure that you are kept up to date. All right, let's get back to it. On the flip side, we may see changes to short-term medical plans, which may be a good thing and could be a good alternative for you and your family. So in recent years, we actually saw that short-term medical plans were expanded, meaning those term limits were expanded for a period of up to 3 years in most states, which is not really so short-term if you think about it. However, as of this year, 2024, short-term medical plan term limits were restricted back to 3 to 4 months, so we may see some changes there. Now, this can be a good thing for people that are ineligible for premium tax credits. They may find that short-term medical plans may offer them a cost saving, and of course, there's more flexibility, more choice, especially for those who are looking for nationwide PPO coverage, which can just be very difficult to find with a marketplace plan. So how do short-term medical plans compare to marketplace plans, and are they right for you and your family? Well, let's take a look at this chart.
So these are some of the key differences between short-term medical plans and marketplace plans. Some of these are good, some of these are bad. So first and foremost, it's much easier to find a PPO plan with nationwide coverage if you're looking at short-term medical plans as opposed to the marketplace. In the marketplace, traditionally, you will usually just find EPOs and HMOs, although I have noticed some PPOs this year. So if you are interested in a PPO, of course, generally speaking, those will have higher monthly premiums, but much more flexibility. You can go in and out of network, which is huge as far as flexibility. And of course, you do not need a referral to see a specialist. Now, also for short-term medical plans, there may be medical underwriting as opposed to a marketplace plan, which has no medical underwriting. Again, this is a double-edged sword. So on the marketplace, no medical underwriting. That means you cannot be charged more or denied for pre-existing conditions. For short-term medical plans, you could be denied, you could be charged more based on pre-existing conditions. Recently, when we had those plans with term limits up to 3 years, very often if you got a multi-year plan, some of those more basic pre-existing conditions, something like maybe high blood pressure, might not be covered within the first year, but it would be covered in the second and third year. So the reason I say this is a double-edged sword is because if you are someone with pre-existing conditions or maybe your health isn't as good, then you may see a higher monthly premium. But for somebody who is in better health, you could see significantly lower monthly premiums. Also, on the negative side of short-term medical plans is that there are no essential benefits as opposed to those 10 essential benefits required by marketplace plans. So that means you could be enrolled in a plan that's wonderful, or you could be enrolled in a plan that's rather crummy. You're not guaranteed things like prescription drugs, prenatal care. In fact, you're pretty much guaranteed you're not going to find prenatal care for a short-term medical plan. And for that reason, we really do not recommend short-term medical plans for those who are pregnant or looking to become pregnant, or even those with very, very young children. Short-term medical plans, generally speaking, are not the best options for you. But because there are no essential benefits, again, you do have those cost savings, or you can have access to those cost savings, and you can really sort of tailor your short-term medical plan to meet your needs because there are so many options. But you are not guaranteed those 10 essential benefits. And then the things we've already talked about, short-term medical plans, if you are younger and healthier, do tend to have lower monthly premiums as opposed to the higher monthly premiums of a marketplace plan if you are ineligible for a premium tax credit.
So again, please do make sure to subscribe. I'm certain there will be changes in the coming months and years, and you want to make sure to stay ahead of it. In the meantime, as I mentioned earlier, there will not be any changes taking place for those 2025 marketplace plans as far as your eligibility for a premium tax credit. So if you do need assistance enrolling, I highly recommend you check out this video over here. And if you want to learn more about marketplace plans in general, or maybe some other options if you're self-employed, I'd make sure to check out our playlist, which I've included as well below. In the meantime, if you have questions or comments, you can reach us at the number on the screen or in the comments below. We are licensed nationwide and there's absolutely no charge for our services. And before you go, please make sure to like and subscribe. As always, thank you so much for watching and have a wonderful day. Bye-bye.